Hello everyone, my name is Maram and I'm a clinical laboratory specialist. In this video, I'm going to talk about the bone marrow transplant. So, what the bone marrow transplant is a procedure that infuses healthy blood-forming stem cells into your body to replace your damaged or diseased bone marrow. Anatomy of the bone. There are 4 main layers of the bone. Periosteum, thin and taut membrane, and the outermost layer of the bone, which is filled with nerves and blood vessels. Then, compact bone, the layer of the bone that is thick and hard, made of many layers of calcium-rich minerals and tough fiber called collagen. Cancellous bone, it's spongy and protects the bone marrow. Bone marrow, large and thick jelly bones, and its make blood cells. We have 2 types of the bone marrow: red bone marrow or hematopoietic tissue, yellow bone marrow or fatty tissue. Red bone marrow or hematopoietic tissue consists of a delicate, highly vascular fibrous tissue containing hematopoietic stem cells. These are blood-forming stem cells. Also, it's used for bone marrow transplantation. Found in the large bone of the body, which is hip bones, lung bones, spines, sternum, ribs, and the skull. Yellow bone marrow or fatty tissue surrounds the red bone marrow. It contains mesenchymal stem cells, also known as marrostromal cells. These produce fat, cartilage, and bone. Totipotent stem cells are immature cells that can turn into a number of different types of cells. The hematopoietic stem cells in the bone marrow gave rise into 4 different lineages: erythroid, which is RBCs, myeloid, which is granulocytes and monocytes, lymphoid, which is B cells, T cells, and natural killer cells, megakaryocyte lineage, which is platelets. Once mature and multiply, these blood cells move from the marrow into your bloodstream and divided into 3 types of blood cells, each with their one job required to keep the body alive and healthy. The white blood cells, which is lymphocytes, neutrophils, and other types that help fight infection and disease. The red blood cells transport oxygen around the body. The platelets, or thrombocytes, that help with the clotting after injury. A bone marrow transplant can be used for various reasons. It can replace diseased, non-functioning bone marrow with healthy functioning bone marrow. This is used for conditions such as aplastic anemia and sickle cell anemia. It can replace bone marrow with genetically healthy, functioning bone marrow to prevent further damage from a genetic disease process, such as Hurler syndrome and adrenoleukodystrophy. It can regenerate a new immune system that will fight existing or residual leukemia or other cancers not killed by chemotherapy or radiation. It can replace bone marrow and restore its normal function after high doses of chemotherapy or radiation are given to treat a malignancy. Let's go to know the transplantation types. Autologous transplant. Patients receive their own stem cells taken from their peripheral blood. Syngeneic transplant. Patients receive stem cells from their identical twin. Umbilical cord blood. Stem cells are removed from a new baby's umbilical cord right after birth. Allogenic transplant. Patients receive matched stem cells from their sibling, parent, or unrelated donor. Haploidentical transplantation. A treatment option for the approximately 70% of patients who don't have an HLA identical matching donor. So, what's the HLA matching? Stands for human leukocyte antigen. HLA are proteins or markers on most cells in your body. Your immune system uses HLA to see which cells belong to your body and which don't. HLA matching is more complicated than blood typing because there are many HLA markers that make a person's cells unique. A close HLA match makes it more likely your transplant will work and treat your disease. Also, helps lower risk for complication after transplant. How to find a match? Starts with a blood test. Patient blood is tested and compared with any potential donors. Usually, doctors want to match between 8 and 10 HLA markers. For cord blood unit, doctors may only need to match 4 to 6 HLA markers. The doctor will start by testing immediate family members. This is because HLA markers are inherited from your parents. You get one half from your mom and one half from your dad. Each of your brothers and sisters, you share the same mom and dad, so you have a 1/4 chance for being match. Doctors are studying how transplant using cells from a half-matched family members as a treatment option for some patients. About 7 out of 10 people who don't have a close match in their family will have to find cells from another source, either adult donor or umbilical cord blood. If you don't have a close match in your family, the doctor can search to be the match registry. Because the match registry is the large likelihood of finding matching is 66% to 99%, depending on your ethnic background. Since HLA is inherited, your ethnicity is an important factor in HLA matching. People who sharing an ethnic background increases the likelihood for a close HLA match. If a donor or cord blood unit cannot be found, the doctor will look at other treatment options. The pre-transplant evaluation includes a variety of medical tests that provide complete information about the overall health. Blood tests, tissue typing needed for allogenic patients only, infection disease screening for hepatitis, HIV, syphilis, and some other diseases. Blood work to check your organ function. Pulmonary function tests. Heart tests, which is electrocardiogram or echocardiogram. Chest X-ray, CT scan, BET scan, bone marrow biopsy. Step 1 of a procedure is preparation. When the doctor finds a right donor, he will start to collecting stem cells in 3 ways. 1. Bone marrow harvest can be obtained for transplantation by bone marrow aspiration. It is generally aspirated from the posterior iliac crest in the hip bone. While the donor is under either regional or general anesthesia, it can also be taken from the sternum and from the upper tibia in children, because it's a cell containing a substantial amount of red bone marrow. The amount of marrow removed depends on the weight of the person who is receiving it. 2. Leukapheresis, or peripheral stem cells, gave certain drugs like GCSF that stimulate the release of stem cells from the bone marrow into circulating blood. During leukapheresis, blood is removed from the donor through an IV line. The part of white blood cells that containing stem cells is then separated in a machine and removed to be later given to the recipient. The red blood cells are returned to the donor. 3. Umbilical cord. In newborns, stem cells may be retrieved from the umbilical cord. After that, removal of red cells and concentration of the mononuclear cell collection. The adequacy of collection may be assessed by CD34 cell count by using fluorescence-achieved cell sorter analysis. For autologous stem cells are generally frozen until needed, and for allogenic collections are usually given to the patient immediately after processing. Step 2. Conditioning. For recipients by high dose of chemotherapy, total body irradiations followed by immunosuppressive to kill any cancer cells. Step 3. Transplant. Infuse stem cell into the patient using central venous catheter, a thin flexible tube, over a period of several hours. After entering the bloodstream, the hematopoietic stem cells travel to the bone marrow. There they begin to produce new white blood cells, red blood cells, and platelets in a process known as engraftment. Engraftment usually occurs 2 to 4 weeks after transplantation. Dimethyl sulfoxide, DMSO, which is used for cryopreservation of stem cells, may give rise to facial flushing, a tickling sensation in the throat, and stranger taste in the mouth, the taste of garlic. Rarely, DMSO can cause bradycardia, abdominal pain, encephalopathy, or seizures, and renal failure. To avoid the risk of encephalopathy, stem cells infused existing 500 ml are infused over 2 days, and the rate of infusion is limited to 20 ml per minute. Step 4 is waiting for engraftment. Cancer-free and healthy blood cells begin to grow. Regular blood tests and transfusion until full recovery. It takes 2 to 6 weeks to return to normal blood count. The recovery time for autologous transplant is between 3 to 6 months. Recovery time for allogenic transplant is between 12 to 18 months. The complication for recipient: 1. Chemotherapy and radiation toxicity. 2. Graft rejection or failure of engraftment due to degree of genetic disparity between the donor and recipient, abnormal marrow microenvironment in the patient, immunocompetence of the recipient, which is dose of post-transplant immunosuppressive treatment, sensitization of recipient to donor antigen because of earlier transfusion or pregnancy. 3. Graft versus host disease, GVHD, may be acute or chronic. It's due to engraftment of immunocompetent T cells that react against the recipient tissue. GVHD occur in 30 to 60% of all allogenic transplant patients. GVHD reaction is characterized by fever, pancytopenia, weight loss, rash, diarrhea, hepatosplenomegaly, and finally death. 4. Infections, which are due to the resulting immunodeficiency and granulocytopenia and are mostly caused by opportunistic organisms, like bacteria infection by either gram-negative or gram-positive organisms, fungal infection by Candida, viral infection by herpes zoster or cytomegalovirus, parasitic infection by Pneumocystis carinii. The precautions: 1. Take prescribed medicine. 2. Have a healthy and well-balanced diet. 3. Maintain personal and oral hygiene. 4. Avoid infections by wearing a mask, frequent hand washing, and avoid crowded places. In the end, thanks for listening. And I would like to say, give us stem cells, give a life.